Tong Ren's key theory is the blockage theory. Western doctors do not pay attention to the blockage in our nerves and arteries. They only prescribe drugs. Blockage can affect nerve signals and blood supply, which in turn reduce our oxygen, our hormone, which is our biochemical system, our bioelectricity system, nutrients delivery, and removal of waste and toxin, subsequently affecting our various organs. Why do we have blockages? What causes blockages? Actually, it's our own movement and our repetitive motion. A lot of time is from our electronic device and how we use our computer, especially laptop. When we're using our electronic device, we'll be lowering our head and causes the curvatures to be incorrect. Laptops, because of the connection, so it's bad for our neck and it's bad for our hand, so that will cause neck problem and repetitive motion problem. And it could be also from past injury like car accident and whiplash, brain concussion, scoliosis, could be surgery, scars, or even from too much medicines, all get deposited into our body and cause blockages. So we created a lot of these problems. Ouch point may not be the root cause. For example, if we have a blockage at T7, our leg will feel weak. The root cause actually is the blockage at our back, but we only notice the ouch point, which is the leg pain. And if there's a nerve problem in our stomach, we will feel sick. So we will need to know how to find the root cause instead of just the ouch point, the pain. How to find the blockage? It's by using our hand. We can feel, and when we touch, we can find the blockage. Once we find it, we can clear the blockage. That's simple and easy. Doctors do not touch. They rely more on the medical devices. Granted that some of those medical devices has improved quite a lot since 20, 30, 50, 100 years ago. Yet, medical devices, they cannot see everything. There's still a lot of things they cannot see, like the blockages, the pinched nerves, the tiny capillaries. So we cannot just rely on medical devices. We have to be our own doctor. We have to know our own body, be aware of the problems. Our body is only sensitive to our primary pain. When our primary pain is fixed, then the secondary pain will surface. So we have to understand our body, the changes, because the ouch point changes all the time. Once we find the blockages, we can manipulate the area and loosen the blockage. You can have someone to do it, like you find a masseuse, find a trainer person, find an acupuncture, or you can use your hand, your finger, even your elbow to clear the blockages. But if you are lucky enough to live in the Boston area, you can find a Tong Ren trainer practitioner to help you. But in the Bay Area, we have to learn to find and clear the blockages ourselves. The way the masseuse or trainer or acupuncture, the points that they work on is very different from the Tong Ren trainer method. For example, they will not touch the neck. They will not needle the neck. And those are our critical points. So if we cannot tackle the root cause, we cannot fix the problem. Acupuncturists, the needle that they use on the skull is not deep enough to penetrate the blockages. So they are very different from us. The best thing to do is do it yourself and using the Tong Ren knife. The Tong Ren knife is sharp, is very focused. The vibration goes deep. And the pressure, it creates the electricity and go charge in our bones. And we can use the knife anytime. We can use it frequently when we are sitting in a car or when we are watching TV. We can use it ourselves, and it's very handy. And you don't have to go to find someone to clear your blockages. You can save the time in terms of chopping and save the money. Before and after chopping, the sound will be different. Like before, it sounds hard, and afterwards, it will be soft and bouncy. And it sounds like a watermelon, and you can see that the blockage subsides. All you need is to chop it for 5 to 10 minutes each time. For prevention, we have to analyze what causes our blockage, what motion, what posture is causing our blockage, and then we have to fix it. For example, if we're using an electronic device, keep lowering our head, or using the laptop, so we have to adjust the device, put it in an eye-level stand and position so that we don't have to lower our head or use the wrong posture. So we have to analyze, prevent that from happening again. When the blockage is clear, we give the body opportunity to start regenerating and healing. So we do the blockage clearing and the body do the rest. The most important information I want you to remember from this video is the 4 major root cause areas. When these areas have blockages, they can cause many illnesses. Head, neck, immune system, T1, T2, T3, T4. Lower part of the body is T7. The brain does not have nerve, and yet it controls the nerve movement and function. The brain is a small organ. It's only 2% of the body size, and yet it requires 20 to 25% of the blood circulation. The arteries going to the brain is limited by its size. If there's any pinch on the side and affecting the blood flow, then you will not have sufficient blood circulation. There are 2 major arteries, common carotid arteries and vertebral artery, coming from the heart to the brain. And then it goes in and forms the circle of Willis. And the small arteries coming out of the circles of Willis would go to the different part of the brain. Doctors only check the major arteries and do not check the small one. And these small ones can cause a lot of psychological, emotional, and physical problem. The basic problem is the blockages on the neck. So if we open up TW16, 17 and let the blood flow, then all these problems will go away and our body will start healing. Our neck and our lower back is the most vulnerable. Our head, we have the skull to protect it. Our chest, we have our rib cage to protect. And then we have the pelvic bone to protect the organs inside. Only the neck and the lower back, we have no structure to protect it. And yet, we can easily cause blockages. We use the wrong posture, like we use electronic device and by lowering our head for a long period of time, or we use the laptop, hurt our neck and our hand, and all these can create problems. And the same goes with our lower back. We slouch, we sit in the wrong posture, we lift things up with the bad posture without bending our knee. When our disc in our neck or lower back becomes worn or gone or get fused together, the doctor will do surgery. A short period of time, there might not be pain, but pain will come back shortly after. And when it comes back, it could even be more severe because the scar will create additional blockage and affect the blood flow and also the nerve signal. Immune system is our defense system. When we have a weak immune system, it can lead to a lot of disease that end with ITIS, such as rheumatoid arthritis, tendinitis, rotator cuff tendinitis, thyroiditis, which is Hashimoto, diabetes 1, food allergy, common cold, psoriasis, and a lot more. So we have to have a good immune system to stay healthy. T7 is the abdominal blood vessels. It affects anything going down in the lower part of the body, including the organs, the physicals, the limbs. And T7 is below the shoulder blades. So if it's pinched, it will affect the oxygen, affect the blood circulation, and also the nervous signals that goes down to our digestion, to our reproduction, sexual organs, prostate, fibroids, even the lower back, the hip, the knee, the feet, the ankle, the bunion, sciatic, pudendal nerve, all those things. So we need to have T7 in good shape. Any of these major root causes can create different illnesses. For example, if we have a pinched nerve in our neck, it will affect our heart, it will affect our digestion, affect our vagus nerve, and vagus nerve controls a lot of organs. So any of these root causes can create multiple problems. To help you find the blockages, the best place is use the lazy bum. It contains all the primary and secondary points for different diseases. So you don't have to remember what it means, the anatomy, the function. You just be a lazy bum and use the book. And you start from the top. When you're checking, you can start from the top, then the neck, and then the spine, and then the feet. The same goes with the turnout. You start from top to all the way to the feet. But be careful, don't touch the front of the neck. When you're checking the head, check for the pain. If there's any softness or sponginess of the head, the scalp, that means it's not very good. And also if there's any divots, it goes up and down, it means there's some deficiency in that area. And for the spine, and check for the pain, for tightness, and if there's any lump or crunchy or ropey, these are not good. And if there's some mole, dot, black dot, where it has up surface or flat, it means something is boiling or bubbling for a long time. There's blockage down there, so check it. And if you find some painful area and you need to clear the blockage, be gentle. It's better to do it more frequently than to work too hard on the painful area. So work a little, wait, and then work again, just do it more frequently. Another thing is you can use it dermatome, page 37, and if there's any pain on the front part of the body, look in the dermatome chart and you'll find the blockage on the back. Since the nerves and arteries for the head and neck are interrelated, we'll talk about them together. To find the blockage, it is easier to have the patient sit up straight in a chair and not slouch. We'll talk about the SCM and the three nerves under the SCM, which is the phrenic nerve, vagus nerve, and long thoracic nerve. Then we'll talk about the medulla. This is the sternocleidomastoid muscles. It stretches from behind the ear all the way to almost to the throat area. And beneath it, three very major nerves. They are the phrenic nerve, the vagus nerve, and the long thoracic nerve. As you can compare to this acupuncture point, they are the LI17, LI18. 17 is for the phrenic nerve, 18 is for vagus nerve, and the long thoracic nerve is all along this area. So these three major nerves all lie underneath these SCM muscles. If you have blockages here, it will be painful when you touch it. And this muscle is very obvious, especially if you turn your head to the other side. The phrenic nerve originates from C3, C4, and C5. This is the phrenic nerve. It comes down the neck. And then it passes through the lung, the heart, and then to the diaphragm. It controls the oxygen condition within the body. If it is blocked, the body's oxygen will drop. If we have lack of oxygen, a lot of diseases will come, including cancer. Phrenic nerve goes to the pericardium. If there's a blockage, it can cause the heart to beat fast. LI-17 is located superior to the phrenic nerve. Vagus nerve is cranial nerve number 9, the wandering nerve. It originates at the brainstem and branches to the intra-abdominal organs. It goes into the heart, lung, stomach, liver, pancreas, spleen, small intestine, and colon, and kidneys also. LI-18 is located superficial to the vagus nerve and may affect the organ's function and bioelectricity. Long thoracic nerve arises from 3 spinal nerve roots, C5, C6, C7, and this is the long thoracic nerve. It is very long and passes under the bronchial plexus, extended along the side of the thoracic, and rested on the muscles under the scapula. It can affect the heart, the lung, and breast area. Due to its long relative superficial course, it is susceptible to injury, either through direct trauma or stretch or sports or from carrying heavy bags over the shoulder for a long period of time. It is very deep and very long from the ear, sinus, and ear to the arm, shoulder, and scapula. When this nerve is pinched, it could affect any of these organs.
So when you push just like that, forward, you don't feel much. Backwards, not much. You hook in front, and then
oh my God.
you pull backwards against, so you're in front of the SCM pulling backwards. Wow, you can really feel. So you get in front of the SCM and pull back almost. See, if you're pushing on it, it's very surface, but the long thoracic is deep. You can feel.
Whoa.
That's a big muscle. You go in front of it, you put it backwards.
Oh my God.
You show on the finger.
Yeah.
The thumb. Yeah. You show on the thumb.
Okay.
Wow. Go backwards. So see, pushing just forward is not enough. Backwards not enough. You're gonna hook in front. Sometimes you don't need to stimulate. You don't need to pull and stimulate. Just a little pressure.
I wasn't
just
really
holding.
doing all that much. I just like
Yeah, just holding it and putting that pressure on that tightness is enough.
This is the vagus, or we call the phrenic nerve. Phrenic nerve can cause the heartbeat because the phrenic nerve goes to the pericardium. You feel it. That is a big one already. So if this nerve, you not open it, so the heartbeat never ever can slow down, only fast. You feel it? It's going down. But this nerve going down to here, then we go to check it. You feel it?
Yeah,
So this area is go for the heart and the breast and lung and the pericardium. See? In here, you feel it. I can hear the sound already. See, you feel it? Wow. So in fact, you are more higher also. See? You see, you can feel the whole liver 14,
right. Left.
So here, but not too much. Here or here? No, here. So that is the liver 14 area. So on the liver 14, then we need to open this area is a long thoracic nerve. You feel it? From the cardiac center, then going to the long thoracic nerve, then go to the liver 14 and the T5 area on the scapula.
Yeah, I feel it's tight. Pressure good? So you could change the angle to see where you're putting the pressure. See, not much here, but at here, you can feel the resistance. So when you change the angle, you can feel all the tightness coming there, so you can stay there. So angle is important also.
To check your own neck to find the SCM, all you have to do is turn to one side and use the same hand. Put the thumb in the position, and the best way is turn your head the other side so that you will expose the SCM here. Put your thumb in front of the SCM with your forefinger holding on to the head, and then grab it and pull it to the back. Grab it, pull it to the back. Grab it, pull it to the back. And then you do it on the sideway. It's just like playing guitar, not going up and down. It's sideway. And then go all the way to the neck. The same thing on the other side is use the same hand on the same side. Turn your head to the opposite side. Use your thumb. Find the position below your earlobe. Go in front of the SCM and pull back. Go in front of the SCM and pull back. And for the collarbone, you can use your finger because it's difficult to chop it. You can use your finger and press on it, massage it to clear the blockage on the ST11 and 12. It could be painful, but over time you clear the blockage and it's not painful anymore. Medulla is part of the brainstem, below the midbrain and in front of the cerebellum. It contains the cardiac center. This is the area of the medulla from the back of the head. From the top of the 2 ears to the bottom of the earlobe, this whole area. It contains the cardiac center, which is also called life center for the heart, lung, and vessels. And it's also recited the 12 pair of cranial nerves. And number 10 is the vagus nerve. Unhealthy medulla can cause heart problem, lung problem, vascular problem like high blood pressure, varicose veins, Hashimoto disease.
Medulla is from the ear to ear area, like this. That whole area, and you know, it's an area too. It's not just one part. You can't pinpoint where in the medulla or where brain function is wrong, but you can feel. You can feel by hand first, and you can say, wow, right here. Any pain there?
Yes.
You feel like right here, if you scan, these 3 areas kind of divot in, kind of softer. Just like 2 spots, you know, in the middle, that you can feel it's divoted. So, like I had a high blood pressure patient, and like the whole medulla area, once again, vessels too tight, the blood pressure skyrocket. So that whole area was like mushy. Yeah. So up here, it just means like a deficiency or something wrong. Do you feel how that's a divot? Everywhere else is like hard. He's very hard-headed, but over there, he's like not enough circulation, not enough blood flow. If you have like the beach where you have like a big hole there, you know, there's not enough sand in that area. There's not enough circulation. You're not everywhere hurt, right? Like this doesn't hurt, but this feels different. Like same pressure. See? Everywhere else you can feel like, a little bit. Yeah. So you could use the knife. So you could just use the tip because when you're looking at the head, it's more of like a fine point. So you could use the tip in the area here. That's both, right? Yeah. How's that feel? Little pain there? Yeah. See? You can hear the difference. Listen to this. Stop for a second. You can hear that versus.
Is it hollow?
Yeah, we already know that. So you can feel like when you are doing it, this area that we found was soft, and you can feel through the vibration that it's soft. Like your hair empty. This one full of nothing. So the more you do it, you can actually feel like it will harden up and then gain more flow. So when you have the flow, you could bounce back up again. And the more you do it on him, you could even, if they're very sensitive to the sharp edge, you could do the flat edge. So yeah, like the head, of course, you have more tender But here, the muscles, you use it all the time and using it so much lightly. Because this is not so afraid for you. So upon like the fear theory, even if they're not afraid, some part of you are afraid. You're like, I'm gonna chop this guy's head off. So your fear is also translated to him too, because you have that brainwave entrainment. Yeah. So then you have that cortisol, all those adrenaline, all those chemicals rushing through. And when you cause pain, then that means we need more attention there. Pain is a signal. That's why when your knee hurts, you don't keep running a marathon, you say you rest, because pain is a signal.
The blood supply to the brain begins with the aorta arc coming from the heart, which supplies the arteries going up the side of the neck. Common carotid arteries, the pink one, is the major blood supply to the brain. And it will split into the internal, which is the green part, and the external common carotid arteries. And here's the facial arteries, and the common carotid arteries, when they get up close to the ear, it will have the 2 points TW16 and 17. Vertebral arteries is the second blood supply to the brain, supplying the blood to the circles of Willis and down to the spinal arteries, C1 to S5. Vertebral artery is very deep and protected by C1 to C6. And this is the occipital artery. It's between the GB12 and 20. And subclavian artery, located in the collarbone area, and it's opened up from the bronchiocephalic artery. And you can tell how it is related to the points here. GB12 and 20 is right here, right behind the ear. And then for the TW16, 17, which is right here, going down. And then for the subclavian artery is ST12, the common carotid artery is ST11. And this is the SI16, which is the facial arteries. Yiming is cranial nerve 8. It's in the temporal lobe, and it is 2 fingers from the bottom of the earlobe on each side. So it's left, this is right Yiming. And it's responsible for like mouth dry, sleep problem due to lack of water, teeth problem, TMJ, saliva, digestion, and even cancer. And the trapezius muscles start from GB20, which is these 2 points, GB20, between GB20 and GV16. So it's right from here to here. So it's from here to here. It's a big piece of muscles covering T1, 2, 3, 4, all the way to T12. And together with Yiming, they are very important for the upper and even lower part of the body, such as the uterus, ovary, kidneys. If you want to get taller, you need to get these muscles in good shape. This shows the different functional area of the brain. Like this 13 is our frontal lobe. Frontal lobe, this is our front. This is where the GV 22 and 23 is. And it is for the endocrine system, for master gland, hypothalamus, and pituitary glands. And the left side is for focus and memory. The right side is for emotion.